Hello guys, welcome back to our channel. So in today's video we are going to talk about a common gastrointestinal condition that affects millions of people worldwide: peptic ulcer disease. Whether you've heard of it before or not, stick around. We are going to break it down and give you all the important information you need to know. So let's dive right into the video. First and foremost, what exactly is peptic ulcer disease, the PUD? Well, a peptic ulcer is a sore or erosion that forms in the lining of the stomach or the first part of the small intestine called the duodenum. This ulcer can be painful and may lead to various complications if they are left untreated. Are we getting the point, guys? PUD, like, it is a sore that forms in the lining of the stomach. That is the simplest definition. Now let us see what causes peptic ulcers. The primary cause is bacterium Helicobacter pylori, the H. pylori. This bacterium can damage the protective lining of the stomach, allowing stomach acid to come into contact with the sensitive tissue underneath. And in addition to H. pylori, the long-term use of the non-steroidal anti-inflammatory drugs, the NSAIDs, vitu kama aspirins, ibuprofen, Indosid, those things can also contribute to development of peptic ulcers, the long-term use. So in case already uko na ulcers, ufai kutumia hizo drugs, vitu ibuprofen, ufai kumeza. So guys, let us narrow down and see the symptoms of peptic ulcer disease. The most common symptom is a burning pain in the upper abdomen. This pain can range from mild to severe and might come and go. So unaweza sikia pain alafu tena ipotee, na by the time inapotea it keeps on worsening kumbe, and you can never know. Okay, this pain can range from mild to severe and it may come and go. That is the point I've just explained. Other symptoms ni vitu kama bloating, nausea, vomiting, weight loss, and even blood in the stool. So if you experience any of these symptoms, it's important to consult a healthcare professional for a proper diagnosis. Usione tu condition yoyote na uanze kufanya nini? Like ignore. Ukiona ni better uone daktari before vitu ziwasen, okay? So let us see, how do we diagnose peptic ulcers? Tunajua aje it is peptic ulcers? How do we diagnose it? Diagnosing peptic ulcer usually involves a combination of medical history. We have lab test where you will do the H. pylori test, and then we have the upper endoscopy. Yeah, that is the use of pictures, okay? And physical examination, but physical examination can come last, okay? And when you are doing the medical history, we usually talk of the epigastric pain, okay? Yeah, so how do we do the upper endoscopy test? A thin flexible tube with a camera is passed through the mouth and into the digestive tract to examine the ulcer and to take tissue sample for analysis. Kuna tube itaingizwa huko ndani, then they'll automatically take tissue samples for analysis. Hope we are together up to there. Now let's see about the treatment options. If H. pylori, the Helicobacter pylori, this is a bacteria that causes ulcer, infection is present, a combination of antibiotics and acid suppressing medications is usually prescribed. Acid suppressing medication ni vitu kama antacids. Another thing is hii yenye tunamezanga yenye iko na omeprazole, esomeprazole, all those. This eradicates the bacteria and help the ulcer to heal once unazitumia. Inaweza heal by the way and inapotea. In case where the NSAIDs are causing the ulcers, your doctor may recommend alternative pain reliever or prescribe additional medications to protect the stomach lining. NSAIDs tumeziona, ibuprofen, Endocid, vitu kama hizo, aspirin, okay? In addition to medication, lifestyle changes can also play a significant role in managing peptic ulcers. It's important to avoid smoking, limit alcohol consumption, and make dietary modifications. I'm a nutritionist and nitasisitiza kwa hiyo dietary modifications. You should avoid spicy foods, avoid caffeine, avoid acidic foods, machungwa, ama hizi beverages. Vitu kama hii kitu inaitwa aje? Sijui hii kitu ikifunguliwa anafanya actually energy drink. That is a very, very good example. So avoid these things. If you cannot moderate the consumption, then avoid them totally, as they can exacerbate the symptoms. Okay? So si tunajipenda, hebu kila mtu take care of him or herself bwana. Tunajipenda, we are here for a season. Hebu jipende. Lastly, let's discuss the outlook of peptic ulcer disease. With proper treatment and lifestyle changes, most ulcers can heal within a few weeks to months. However, it's crucial to complete the full course of prescribed medication, even if symptoms improve, to prevent recurrent. Hata ukishasikia uko better, endelea tu na dose ndio isikuje ikarika baadaye. Hope your point iko clear. And I want you to remember this. Peptic ulcer disease is a serious condition, and self-diagnosis or self-medication is never recommended. Always consult a healthcare professional if you suspect you may have a peptic ulcer or if you are experiencing any of the associated symptoms. Okay, guys, remember, that is a note.